I'm the People Participation Lead for Norfolk and Waveney Children's Families and Young People Services within NSFT. So that includes our CAMHS team, youth team, our learning disability CAMHS team, our under 18s crisis team, and also adult ADHD. So we have participation leads that work within lots of different areas across the trust, from adult services to secure services, specialist services. And as participation leads, we all have our own lived experience of mental health, whether that be personally managing our own mental health or caring for somebody who has mental health concerns. So for me personally, I was under NSFT services as a teenager, and I had some really good experiences but through my recovery, but also some not so good experiences. And essentially that's why I'm here today, why I'm in this role, because I'm really passionate about improving our service and wanting to make changes that are meaningful for those that use them. So my role is to ensure that all the people that use our services and their families and their carers are at the centre of everything that we do at NSFT. And that involves listening to those who use our services, hearing your experiences and feedback, and using that to help us make those changes and improvements to our services. So some of the ways that we do that are by setting up projects to look at improving the quality. We also have a group of young people that use their experiences to shape the way we deliver our service, and they use their voices to ensure that our service meets their needs. And we also hold talks like this with people either as a group or one-to-one to allow yourselves the opportunity to tell us what it's really like and what we can do better. We can't solve and fix everything, but we can certainly listen and take your experiences and ideas to start making changes in the right places.
And I'm an operational manager and I work alongside Lucy. And my background personally is I'm a nurse and a therapist, but at the moment I'm employed as an operational manager. And I work with the under 14 team in Central Norfolk and the under 14 team in West Norfolk. And next week I'll be working with the under 14 team in the east of the region as well. So I'll eventually work with all the under 14 teams across the county. I also work with the 0 to 4 team, and I'm about to pick up and work with the Waveney learning disability team as well. So not quite all the teams that Lucy mentioned, but some of them. And as an operational manager, I get to work with the senior clinicians and team managers to make sure that the day-to-day service keeps going. So we try our hardest to think about how we can reduce our waits for assessment and also treatment.
Hand out my email address and my phone number too. So if you want to get in touch afterwards, or maybe there's something you think, oh, I should have said that, get in touch with me and we can have a chat as well. And just so you know, I'm going to keep some notes of what you're saying, but all the feedback that I get is completely anonymous. I record it anonymously unless you specifically request otherwise, if that's okay with everybody, just so that I've got a record of it as well. And then following this, I'll tell you kind of what happens next with that feedback, and I'll give you my contact information. Is that okay?
Great.
All right then, so I guess then I'm opening the floor to the first question, which is, what are your experiences of accessing our services?
In terms of how we go about this, should we all turn our mics off and then whoever wants to speak can put their hand up and then turn their mic on, something like that?
Yeah, that'd be good. Yeah.
I think otherwise we may constantly be kind of.
Can you remind? I'm so used to Teams and not this. How do you put your hand up on here?
Is there a?
There's a button that says reactions.
Right. Okay.
So if you click on that, it says raise hand.
Raise hand.
Brilliant.
Like that. It's just a little hand that comes up in the corner.
So if anybody's having problems with that, just type something in the message in the chat, just to say, I can't find raise hand, I've got a question, and then we can come to you. Or type the question in chat if you don't feel like you want to speak on the microphone as well.
Yeah. That sounds good.
Wow, you've got perfect service. Anyone?
Well, I've got hang on, Lee.
Oh, Lee.
So
just unmute and turn the stuff on. Good morning, everyone. I've always got something to say, so I'll start us off, unfortunately. So thank you for joining us, Alan, and thank you for joining us, Lucy. Some of you that don't, I presume a lot of you probably know of me or my service, but just to give you an idea, we support people on the autism spectrum, regardless of their diagnosis, stage of life, or geographical location. One thing that we found last week, we held the Norfolk Autism Forum last week, and a big thing on there was accessing mental health services for those with a diagnosis of autism. What people tend to get, especially younger people, is when they are referred to a tier 1, tier 2, tier 3 to tier 4, whatever part of the service they're referred to, they are often rejected or pushed back because they have that diagnosis of autism. So instead of receiving any kind of therapy or help for a anxiety or depression or any other mental health, they're normally just said no because it's part of the autism. And I know quite a few people in this chat as well that have had that experience. And that's just something I want to bring up at every session I do, is that you can support the autism. You know, you obviously can provide strategies in that, but sometimes the anxiety, the depression, and the other mental health problems need to be taken separately and dealt with separately in a way that is good for those on the spectrum. So typically some of your talking therapies, you know, CBT, your group therapy sessions don't work as well. And I think it's, you know, I was at the steering meeting yesterday for SENDIAS, so the SEND Partnership, which is the educational support service in Norfolk. And they've had their biggest lot of referrals is from those on the spectrum with ASD. So I think it's just important that we understand that those with autism can have mental health alongside the ASD diagnosis, and that's just accepted in the service as well. Am I making sense, or am I just waffling at 10 o'clock in the morning?
You're making sense completely.
Making sense. Thank you, Lucy. Yeah, I've only had one coffee, so this may go very, very wrong. I may not be understood, but I just need to make that clear to all the mental health services that I talk to, that needs to be taken into consideration as well. And I'm going to stop waffling now and I'll let some parents speak.
Yeah, absolutely. Thank you so much.
So I've got a an expression and a sharing of experience in the chat. Can I read that out, Al and Lucy? So
Yeah, please.
Accessing services have been very poor with long delay. Lack of understanding when it comes to complex needs children and mental health. How do we approach this barrier when accessing the service? So consistent really with what Lee was saying around how a diagnosis or complex needs interacts with mental health needs. Have you got any kind of response to that? What are you thinking along those lines?
I think this is more of a question for Al, if that's okay, Al.
Yeah, of course. I think it's a real shame that this has happened, and I'm sorry. If I'm honest, we should be supporting you guys, and just picking up on something that Lee had said, a confirmed diagnosis or anything else of ASD or any neurodiversity shouldn't be prohibiting you accessing our services, and we should be making adaptations to the support that we offer to give the best possible support we can. Unfortunately, we do have long delays at the moment, and that really worries us. It feels at times that we don't have enough capacity to meet the demand. And we're trying really hard to work with our commissioners to think about all that we can do to be as efficient as possible and to pull in extra resource when we can. But the bottom line is, this shouldn't happen. People should be able to access the service, and they should have treatment that is supportive to them, and anybody should be able to get that in a timely manner. And we should be able to make adaptations as nurses, therapists, other mental health professionals that best support individuals and their needs.
Thanks for that response, Al. I think you know, there's certainly a lot of need to individualize responses, you know, whether it's complex needs diagnosis or whether it's individualizing in any other way. Hopefully services will get better at that. I've got 2 hands up. Can I bring in Teresa? Hi, Teresa.
Hello. Andrea, did you want to go first? Because I think you were first, but
You're on mute, Andrea.
I said yes, I was, but it's fine. You can go first, Johnny.
thank you. Yeah, I just wanted to say, I guess, what's your experience of existing services? We haven't had any experience because we've just been waiting. The experience is waiting and waiting and waiting and waiting. So I can't really comment on what that service is because we haven't got there yet. And we're talking like a 2-year wait for point 1. And at times it just feels that you have to have your child at crisis point before anything is done. So there's no preventative action happening with the service. It's just when your child gets to the point where there is nothing else that you feel that you can do, and that's when someone kind of steps in. And we've felt at times that we've got to that point and we've still been turned away. And I guess my frustration is things like, I know that I don't know if you know about the Individed website, the kind of tool. It's so it's like I think it's a little bit like a kind of supportive tool for teachers and schools, a little bit diagnostic for them to work with. County Council have offered that to every Norfolk school, as far as I'm aware. So my son's school has started working with him online with these kind of quizzes and questionnaires that help find out where he is and what support he needs, and then it offers kind of resources and support for him. And some of the diagnostic kind of reports that have come back talk about that he needs urgent multi-agency intervention, that he has really critically low self-esteem, all these issues that we know about, and it's being shared in this diagnostic tool that is being offered to us by County Council. And then when we try and access that, we're told no, he doesn't reach that level yet. But it's there in the tool that we've been asked to use with him to find out what we can do to support him. So you're saying he needs support, but we can't offer it to you.
What was that software called again, or the tool called again?
It's called Individed.
Okay.
It's like an online, I'm not exactly sure where it's come from. It's something, but I was under the impression that it's something which has been kind of opened out to all Norfolk schools, that is something that can be used as a tool to support kind of teachers and children. I guess kind of in the absence of actual people to do that, maybe, and services.
So Teresa, can I just respond to that? I just want to kind of sort of put it in a nutshell, just check out my understanding really. So are you kind of saying that there are lots of services and kind of formats for assessing children and confirming their needs, but actually that isn't helpful when there's nobody to help you with meeting those needs? It then just comes back to schools and parents. Is that kind of what you're saying?
Yeah, I think so. And it is that thing. I'm kind of a bit at a loss of where to go now. The school is at a bit of a loss, and it's just waiting and chasing up. And every time you chase up, you get told the same, that you're one of many, many, many people. And and I questioned how to expedite his case and move it up to kind of tier 3. He won't get to that point because the criteria doesn't relate to him, but it will do when he continues and gets to crisis point. And I don't want that. That's the point, that it shouldn't be at that stage. We know with mental health and well-being that if you catch it early and you put those preventative strategies in, then you can prevent that. But we're not. We're just kind of allowing children to fall, basically.
Teresa, can I check that I've understood what you said properly? And so stop me if I get this wrong, but to me, it feels like what you're saying is there isn't enough preventative work in the county, and that whilst people are waiting, not only is it far too long, but there's not enough support while you're waiting to access services. Is that right?
Yeah,
I think you
yeah,
had,
I think that's correct. Yeah.
and forgive me if I got this bit wrong, but I think at one point you might have said that Point One, which is our kind of sister service, another provider in Norfolk that we try to work really closely with, that their waits are about 2 years. And I can see I've been really worried. So, Zoe in the chat has talked about young people waiting up to 5 years, which is just, it must be intolerable. So is it with Point One in your particular case, Teresa, that you're phoning and saying we need help? And
yeah, that's kind of where we've been at, and actually Point One felt like it probably was the right service at one point, because we were at that point where, yeah, a short kind of, service that would work with him for 8 weeks might give him some really good strategies to kind of move forward positively. But now it feels that we've been waiting so long for that it's escalated and it's gone past that point, but he's not quite kind of there, and that's still what they're offering us. And it's escalated, and it just doesn't feel like that's going to be enough now. Whereas if we'd got that service, a year, 18 months, 2 years ago when we requested it, that might have done that job. And yeah, I think we've been waiting, as I say, 18 months, 2 years. When I phoned up a couple of weeks ago, we are nowhere near the top, nowhere near. And we were offered online support during lockdown, during COVID. That's totally not appropriate for my son. He would not engage with that. So yeah, and it relates very, very much to the comment that Lee offered about autistic children, and yeah, all of that waiting. My child has got lots of complex things going on, but all of that kind of absolutely I agree with.
Yeah. And so it's important to make the right adaptations and offer the right kind of support, isn't it? So a webinar might not be appropriate for everybody, for example. That's one of the things that NSFT are trying to look into developing whilst people wait, to see whether that's helpful. But to me, what on a personal level, I guess I'm thinking it's a flawed and unacceptable system that a child needs to get worse before they get seen. That doesn't feel right. To have to go through that escalation. And also I think that for me, what it feels like you were saying, and I completely get it, is if we'd had the support we needed quicker, we wouldn't be in this situation today. So about timely access to support. Yeah.
Thanks for sharing that, Teresa. Can I bring in Andrea? Thanks for waiting, Andrea. Very patient.
You're welcome. It's fine. Thank you. I wanted to go back to what Lee said actually about once you access CAMHS, or if you have autism or ADHD, it's always been, I think it's quite a historic thing actually, where it's you've either got a neurodiversity or a mental health issue, and if you have both, it's like, well, which kind of way do you go? And I think that, like Lee said, if you go down the CAMHS route, and actually if the clinicians have that experience of autism, ADHD, and then neurodiversity, it would help. But from my point of view, I've got my children are now 17 and 19, and they're at an age that kind of lots of anxiety, and my youngest one particularly. We've thought about, see if we can get a referral to CAMHS, etc. But I do worry that the support or CBT or anything like that, because it's not based around ADHD, which is what he has, the terminology and the discourse that's used within that therapy, talking therapy, is sometimes kind of a little bit counterproductive. So it's like, try and be consistent, maybe they might say, or just things that that somebody with a short-term memory may not be able to do. So it's not quite. So I do worry myself, him accessing it, and worrying that actually it's not going to support him in the right way, if that makes sense. So that was one thing. And going back to what Teresa said about the 2-year wait, and I agree with everything that you're saying. What I wouldn't mind putting to you, Teresa, is what, apart from obviously having shorter queues and being seen immediately, are there any solutions that you could think of that you could kind of put forward to kind of let us know what maybe would help in a long queue? Like, you know, have you been contacted to say that hi, we haven't forgotten you, we know you're still on the list at any point in those 2 years? Or have you been sent any leaflets, or has anybody called, or anything? I don't know. Or what would help your young person? Would it be, you know, a youth group with other children? Or I just wondered if there was any solutions that you thought of that maybe you could feedback to the team. I think that would be useful, wouldn't it, Lucy?
Yeah, I haven't come up with any solutions other than you need to speed it up, and I guess it is workload, isn't it, for the people you haven't perhaps got enough. I don't know, you know, people that can offer this service, but no, I haven't really had any contact points. It's been me kind of requesting or phoning up and trying to find out where he is in the waiting list. As I say, I did have that contact point in COVID that offered online support, but it doesn't work for him, so it's just carry on waiting then. Yeah.
It's been useful to understand others, because we've got obviously NSFT, and I personally think that it's really nice if you're on a waiting list to have that, you know, hey, you're still on the list, we haven't forgotten you, because as you know, 6 months, 8 months, a year goes by, you just think, oh, you know, are we still on the list? Have I got to start again? And but also, is it useful to understand what other services are about, like, you know, in the voluntary sector, for instance? Would that be useful? You know, like SENsational Families has a family support advisor service that can support parents with things. You know, would that be useful for the NSFT to maybe give you pointers of what other services are available? Did that happen? Did you hear of anything?
Perhaps. I mean, I have to say, I think I'm probably quite a proactive parent, so I seek these things out myself anyway. Yeah, but I guess if you're kind of not, you know, of that ilk, or actually many of us just simply don't have the time, and we would like support with that, then yes, I suppose that would be helpful.
It's hard, isn't it? Because when you know, your child is suffering and experiencing what they're experiencing, no amount of, you know, letters or advice. You just need somebody to see them and kind of help you out. So I do get that, but I definitely think it's worth, you know, if anyone has got solutions to feedback, I think that's always good, because from your perspective, I think that it's really valid to know what would help. But yeah, that's me done. Thank you.
That's fantastic, you guys. And I think, you know, we have to encourage thinking collectively about what may have made it a bit easier. Obviously, Al and Lucy and the rest of the team are working in a overwhelmed and under-resourced organization and service, and so, you know, we have to be really creative and feedback, but in terms of how it could be improved. So definitely want you to think about that, and I think, you know, we'll come on to that a little bit later on, perhaps. Can I bring in Leonora? Leonora, thanks for your patience.
That's okay. Can you hear me?
Yeah, perfect.
Yeah, I have, my daughter's been under CAMHS, and I've got nothing but singing their praises. They have been really good for us, but we were very lucky because, well, say very lucky, she was admitted overnight at Norfolk and Norwich because she had a massive breakdown. It was just horrible, and we called the ambulance. Ambulance didn't come out. Was waited at home for 3 or 4 hours. In the end, she was seeing people in bushes, she was completely having voices, everything, and she just completely broke down. And she was kept in overnight, and we saw the crisis team the next morning, and they were good. But I mean, it took about 6 weeks, but she's actually been under CAMHS now since year 5, and she's now year 9. But CAMHS, I can say everyone we've seen CBT, we've seen someone for family therapy. We're back on the list again. We're still waiting. Obviously, they discharged her. She's gone back again. She's now been put on medication. It's due to severe anxiety, but she's now being assessed by an educational psychologist, and they're going along the ASD line. And obviously, I've been asking school, I've been asking CAMHS for ages, could it be anything like ASD, or, oh, no, we're just treating their anxiety. But I know they have to sort the anxiety out before they can actually look at something else, you know, do the ASD. But I mean, they have been really good, but obviously year 5, my daughter didn't really want CBT. She'd go in, she'd have the hour, and then she'd come home, we'd try and do things at home, and it didn't work. She didn't want to do it. And I think, you know, these things are good, but they do have to want to do it. And, you know, family therapy, to be honest, they were good in some respects, but it just felt like it was a bad parenting class. You know, I don't know. I mean, they have been. I mean, we are lucky to still be under CAMHS, but obviously, yeah, certain things work for certain people, but they didn't really. It was CBT or family therapy. That's all we've been given. Obviously, she's seen a nurse now for medication, so she is on medication. But yeah, I just feel for people who have this massive long wait, and it's just, you know, it's a relief to actually get it, but you know, it would just be nice if there was more there to offer people. Because obviously Gracie now has been off school she hasn't been out of the house really, apart from 3 days. She tried going back to school this term since last November. And obviously CAMHS appointments. But we're getting no help, as in, you know, getting her into school. School have kind of like just throwing their hands up in the air saying we can't do anything because we can't do anything to get her in. And, you know, short of dragging her by her hair to school, we're not going to do that. And, you know, we're going down the lines of, you know, fines and things. And, you know, it's stressful. It really is stressful. But it's just, you know, I know they're overworked. They are overworked. We've been there. We've seen, you know, they're running around like headless chickens, bless them. And, you know, there's only a certain amount of people to go around. But yeah, it's just a shame people have to wait that long.
I think that's,
Sorry, go Andrea.
I was just going to say, I think it's lovely to hear a positive story, and I think, you know, you've you know, kind of hit the nail on the head in the fact that I know Al and Lucy well as colleagues, and you know, the passion within the team as individuals is absolutely amazing, and to highlight, you know, it's a system issue, and it's you know, I know that, you know, a lot of the team, Al, I know that a lot of your team, you know, can get so frustrated, but, you know, by the weights and you know, so it's just nice to highlight that the positives like that, and also to recognise that, you know, I mean, just the individuals there do the job because they're passionate, and it is a massive system problem, and I think if we can do anything locally to just do something just tiny in that weight, or just, you know, within the capacity that there is, I think that's amazing. So I think what you said, thanks for sharing that. That's really, really good.
Yeah, I really appreciate it as well. Thank you.
Yeah, I just wanted to say before I bring in Zoe and then go to Rosanna's question in the chat, that Lenora, it sounded very much like you had lived what Teresa was talking about, where
yeah, it's been a hell of a journey. Still doing it, but you know, all we can do is support, and it's
but it's that kind of knock-on effect of school not being active and urgent enough, and potentially kind of mental health services being difficult to get to, and only when you get to that crisis point where you must have been so distressed and your daughter must have been so distressed.
Yeah.
Do you actually then access services which do make a difference, and so you have a positive experience, but only because you had such a worrying experience within your family? And I'm really sorry that you had to go through that, and I'm sorry that that is the situation. It sounds like you've really managed that situation really well, and you're obviously a very, very caring mum. And I just wish that level of care and commitment was possible from services as well. And unfortunately, we're in that situation where there's a huge endeavour to be that, but the lack of resources, the lack of time, being overwhelmed means that it rarely translates into that.
I mean, I think schools as well, schools really need to, I mean, they have their own SENco, and our SENco is actually quite good, but I have been over the last year and a half saying, look, there's something else wrong with Grace. It's not anxiety. Well, it is anxiety, but there's something else there. And I asked them, does she warrant? Even the educational psychologist says, no, she doesn't need it. And it just happened that we got Sandy and obviously SENsational Families, Leo from SENsational Families, and she basically said, push for this educational psychologist, and we did. And she was lucky enough that obviously there's another way to see them, isn't there? But she actually got to go just before summer holidays, and obviously we've got this report back. So we have been lucky all around, really, but it's just taken that time to, get this report through, so we can actually now decide to do it. And school now have said, yes, I've seen that in other girls at the school, and I think that's what she has. That's all I've been asking for the last year and a half, just for someone to come along and say, right, well, it could be this. And it does, it does start to make sense of what we've been going through with her as well.
But thank you for sharing and giving us the opportunity to learn. So Zoe, thanks very much for your patience.
Thank you. That's okay. I think what I want to ask kind of does roll off the back of what everybody else is saying, but sort of I have got a couple of questions. One is I've had two different experiences with CAMHS with two different children. One is a 5-year wait despite emergency reviews when they were in crisis, despite the fact that they were signed off sick from school for 10 months, and we ended up deregistering because it was another battle that we were having to deal with and take focus away from our child. So that's one experience, that 5-year wait. They've had 4 urgent assessments, every time been assessed that they need urgent support. That support's never arrived or been followed through from services. We've been asking for it. Equally, we found during that support, there was a real lack of understanding of autism. Comments during those assessments were things like, well, if you didn't stim, maybe other children wouldn't notice you so much or wouldn't be unkind. So that's still a major issue within CAMHS, and it really does need addressing. Because, as parents, we're at home working with our children with their mental health to try and keep them above water, and you turn up to an assessment and they undo everything you've done whilst you've been waiting 3 months to be seen in one sentence, which actually makes people reluctant to access the services as well, because not only is it so challenging, once you're getting to the services, they don't understand the children and their needs. After lots of complaints, we had a recent assessment, and during the assessment, my autistic child, well, adult now, was asked how they felt in year 7 during a mental health crisis. That shows the real lack of training and understanding of autism within the CAMHS team. Because
Zoe?
Yeah.
So, Zoe, can I just ask in terms of what would have been different, what would have made a difference in your experience?
Yeah, what would
Yeah.
have made a difference? So my other experience, which is now turning it unfortunately into the first experience, was that referral was done. It went through to Mary Chaplin House. The support nurse I've spoken with has a much better understanding of complex needs and autism. So communicating with them and getting advice and guidance has been much better, because you're not spending hours going over the same questions that just don't work for somebody with complex needs, just aren't appropriate. They're taking a neurodiverse approach to the support they're offering. We're on a wait list with Mary Chaplin, despite it being crisis. However, for the first sort of 8 months, I was getting a phone call every 4 to 6 weeks, and I could ring up if there was any issues in the meantime, where we were really concerned. And that appointment on the phone involved going through everything we were dealing with, any changes, and discussing approaches we could try appropriate with the complex needs that we're also dealing with alongside the mental health. That person's now gone on maternity leave. We're just on a wait list. So we're still on that wait list, but there's now no contact. Had that contact been in place first time around for my eldest, that would have made a huge difference. What if had that contact still been in place for my other child, what a difference it makes. Being able to discuss your concerns, go over any things that you can do to help at home. My children are both home educated now, but obviously for those who've got children in school, they should be giving parents things that schools can do to support as well, because obviously they need that consistency at home and in school. It's all good and well as parents doing everything we can at home, when it doesn't then transition into a school environment. It's got to be round the clock, everybody on the same page. The approaches need to be consistent.
Zoe,
Yeah.
just give Al and Lucy an opportunity to come back on that. So really what you're saying is what made a difference was the level of training and the level of awareness
Absolutely.
of complex needs and children with diagnoses. So
Yeah.
Al and Lucy, your thoughts on that?
So the internet connection cut out a bit here. Sorry, could you just say, could you sum that up again for me?
So just to summarize, Zoe's points really was what made a difference was when she experienced the Mary Chapman House services, she found them much more attuned to complex needs and to children with diagnosis, and that really made a difference in terms of how effective the support was, even though they were on a wait list and it was a crisis level.
Yeah, that's really helpful to hear, and thanks for summing up for me again. So I wanted to acknowledge that, but I also wanted to say how sorry I am to hear about a 4 or 5 year wait. That just doesn't feel right to me. And if anybody is waiting that long, please let me know and I'll look into it for you guys. I think that's helpful. And at Mary Chapman House, which is where I am today, there is actually a small team that is dedicated to helping in these situations. And we're actually trying to grow that. So we have some individuals that we've recruited specifically to train them to work with neurodiversity or learning disability presentations. So we've got 3 practitioners that are about to qualify, and we're currently advertising for another 3 posts. So it's not enough, but the workforce is growing. It's our plan over the subsequent years to build that resource and to have more and more practitioners that will give you that better sounding support, Zoe.
That's really good to hear. Al,
yeah.
I only want to do this just because I feel like the scale needs to be kind of known, but the number that you talk about in terms of sort of clinicians that are specialized along those lines, how does that compare with the overall number of clinicians? I mean, we're talking 3 out of 400, 3 out of 200.
So in the Central Under 14 team, the team is about 30 people, although some of them work part-time. And the particular team that we're talking about is one full-time advanced nurse practitioner who prescribes as well as diagnose and treats people, and one assistant practitioner, and then the trainees that I talked about. So in total, 3 or 4 people.
Okay. Thanks very much for sharing that, Al, and thanks very much, Zoe.
Could I just say something? Is that okay?
Yeah, absolutely.
In terms of the waiting times, that's feedback that I have received since I started this role, which is in April now. And our young people have been talking about communication and awareness and understanding. And since April, our young people have been helping us basically on lots of different projects. But one of the things we're now taking from that is developing training to help create awareness of specific and individual needs, how to communicate with people better, because some of the feedback we get is it's quite clinical and there's a lot of jargon and we don't understand what we're being told to do, and we're not working together. I'm being told what to do. I don't know if that is something that kind of relates to this, but I'd be really interested to kind of do something similar, but with parents and carers. So if there's anything that sort of following on from this meeting that you would like to get involved in, kind of similar to that, please get in touch with me, because we can work on that and get something going so that we can improve this.
Fantastic. Lucy, you're going to put your email in the chat?
Yes.
Yeah.
I'll put my phone number, so I'm happy for you to get in touch with me however you want. So if you would like to email me and just talk through email, we can arrange a video call through Teams. You can call me, text me. I also have WhatsApp on my work phone as well, so you can WhatsApp me. Yeah, however best you feel communicating, really.
Well, I think everybody gathered here today who's had experience with a young person with a neurodiversity or a diagnosis who's tried to get mental health support would like to see much more individualized and attuned services, and therefore would probably want to be involved in making that happen. All right, just a kind of nods. Would you yeah, I'm seeing a few nods. Okay, well that sounds good.
That'd be great. Yeah, thank you.
Rachel, I can see you've got your hand up. Rachel, before I come to you, I'm just going to ask another question because somebody has to leave soon, okay? And then I promise I'll come to you. Zoe, can you put your hand down, do you think? Okay, so Al and Lucy, this is a question in the chat, okay? Okay. So, so this person's in urgent need. Okay, so I was wondering if there was any way to fast track to get anti-D meds. My ASD 16-year-old is extremely anxious and depressed and refusing school. I think he needs meds, but the GP won't do it without professional input due to complexity of situation. Obviously, he needs to be seen now, but the service just isn't accessible enough. Any response to that?
Yeah, so if I'm correct, if a GP is open to the idea of prescribing antidepressant medication but doesn't feel comfortable, one of the things they can do is phone up and speak to one of our duty clinicians or our doctors or non-medical prescribers to just get some advice. And that's something we do quite a lot, and we can support the GP in prescribing antidepressants. So in that particular occasion, if it's helpful, the GP should just be able to phone and ask for a consultation, and we should be able to give some advice.
Okay. And then a follow-up question is, what number would they call?
Well, it depends is the unhelpful answer. So whether the person lives in central, West Norfolk or East, and whether the young person's over the age of 16, I think you said, was that right? So it would that would be the youth team. But if I, after we finish, if I send you guys the telephone numbers for the under 14s and the youth teams in those 3 areas, would that be helpful?
Would that be helpful? I'm just waiting for the chat to confirm that it would be. Yes, it would.
Cool. Well, I'll make sure we do that.
Al, thank you very much for that.
No.
And Rachel, thanks for waiting.
That's
Be
all
great.
right.
Be great to hear your voice.
Hello.
Yeah. Hi.
Yeah, no, I just wanted to say that I have 2 experiences for CAMHS. The first one is for my son, who was diagnosed with autism when he was 2, and he's now 4.5, so he's very young. But he, with his high level autism, he is very anxious, doesn't like leaving the house. With COVID as well, we kind of just got stuck in early panics all the time, and I was looking for any and all services that would help him transition. I've been looking for private therapists, play therapists, behavioural therapists, and apparently I've got an unfortunate postcode, and I did apply for CAMHS for him, knowing that there was a wait, and got told that he was too young and to wait until he was in school. And at the moment, I'm finding it difficult getting a referral at the moment, because he doesn't seem severe enough, I guess. And the other one I have is I've got a half sister in Essex who is deaf, and she's 14. And last year she got physically assaulted. She got exploited online, and she was raped, and CAMHS came in straight away with somebody that knew sign language, and was able to help her because she was threatening suicide because of everything that had happened. So they're really different, really different experiences. Obviously that other one was obviously in Essex, must be a better postcode, I guess. Is there, my question is that, I know that it's NHS provided, I can see on Google. Is there any plans to petition for extra funding or extra support from the government? Is there anything that we can do as social media warriors, get a load of signatures and complain and help improve the service by poking the people with the money?
That is a great question, Rachel. And I think what you've shared about the contrast in responsiveness and individualized response over the border in Essex is great, because obviously all of our services learn through comparison and through what is best practice and trying to kind of replicate that. So brilliant that you've shared that. And also, Al, I remembered you said you were in the kind of 0 to 4 team as well. So maybe this is a good one for you to kind of offer your thoughts on.
Yeah, so keep me to task here, guys, because I might go off, but I think it's quite kind what you just said, Rachel, and I just wanted to acknowledge that. And it does feel to me that we don't have enough resource, and we talk to our commissioners all the time about that, who are actually very sensible, approachable, likable people who I think feel the same way. I know that the government, through various kind of policies and legislation, are committed to giving more money every year to young people's mental health services. And they're saying, I understand, that they're going to do that at a higher rate than they will for the adult services. So over the next kind of 5 years, the amount of new money that comes into children's mental health should be greater than it goes to adults. And that's fantastic. Personally, I worry it's not going to be enough. So any kind of campaigning or petitioning that anybody would be able to offer us, I think, would be really welcomed. It's really frustrating and toe curling how long our waits are, and sometimes I think we have to make some really difficult decisions, unfortunately, and we do that because we don't have enough capacity. So any help you could offer us on getting some extra workers, whatever that might look like, would be very welcome. And I guess
I'll start nagging some people, raise a bit of awareness and stuff. I don't know.
And I think I jumped on that bit, but I didn't answer the first question, Rachel. So can you just remind me again, what would be the help? What would be the most help that we can give you with your son at the moment?
I mean, personally, at the moment, I'm struggling to find services that will work on a one-to-one, face-to-face basis to actually help my child develop less anxiety as he grows up, because he is so young and malleable. Apparently, yeah, I've got an unfortunate postcode, and I understand that he's not a crisis point by any stretch.
Rachel?
Yes.
I just wondered, because you said you've got an unfortunate postcode 2 or 3 times now. What does that mean? Is that you're on a threshold like Waveney or Wisbech, that kind of thing, or?
No, I'm in Dereham.
No?
Good old, sunny old Dereham. I keep saying that because I've been turned down by a couple of places. Obviously, COVID hit pretty hard, and a lot of things have closed down. Like the Sure Start centres, obviously, have gone, and a lot of the support groups in my area died because of COVID. And when I've looked for private therapists, behavioural therapists, or play therapists, speech therapists, I've been turned down by every single private therapist I can think of, because apparently they don't deal with my postcode. So that's why I say that. So at the moment we're kind of working with the school. Obviously he's only just started mainstream school, and we've got a long journey ahead of us, but yeah, I can't seem to find anybody, even if I paid.
That sounds like a mystery that you would really like cleared up, a little more clarification on that. Right.
Dereham, I can't drive. Dereham seems like a hub. You know, we've got it's a large town. It's, you know, it's got buses and things, but there's not a lot going on in it, and people don't seem to want to.
Yeah, I was really curious about the unfortunate postcode as well, so thank you both for clearing up. But I was surprised Dereham shouldn't prohibit or get in the way of getting any support. If I'm honest, sometimes people that live in the kind of Thetford, Norfolk, Suffolk border, that can be a bit difficult, because it gets a bit confusing there whether it's the Norfolk or Suffolk team that supports, and the same, like you said, in Waveney. But there shouldn't be any issues in Dereham that would fall under our teams.
Yeah, no, I've managed to get in touch with charities and people like that for advice, but at the moment I can't seem to find anybody that will give me hands-on help.
Just on that subject, Rachel, have we still got Lee on the call? Because I don't know what age Lee's services start, but did you say that your child had a diagnosis from age 2 of
yes autism? Yeah, no, I've got my son a diagnosis at the age 2. Yeah.
Wow.
Lee.
Hello, yeah, I'm here. Hi, Rachel. Yeah, I did have a look. Rachel has contacted us, and I've sent you an email, Rachel, back in July. Yeah, I don't know if you received. I can resend it again after this meeting, so that's not a problem.
Oh, bless you.
Yeah, we do have our support. So I'm going to take over a bit. I do apologise. We do have our support group in Dereham as well, which is running again.
Right. Okay.
We were meant to have one this Saturday, but I feel rough as something I'm not going to share on Zoom. So our next one is 2 weeks on Saturday at the Scout Hut just under the flyover on the way to Topwood.
I know where that is. Sorry, what date is that?
That will be the 19th of October.
Tuesday 19th.
Yeah, 10 till 12. That is. So you're more than welcome to come and join us for that if you'd like to.
I could go, but my son has school.
On a Saturday. Oh, it's a Saturday morning.
Where am I looking?
19th. I hope it's the 19th of October. Bear with me.
19th of October is a Tuesday.
16th, you mean?
Sorry, yeah, 16th. Sorry, I don't know why I've added 17 days to 2 weeks, but no, it's the 16th. Yeah.
16th. Beautiful. Okay. Sorry, did you say 10 till 12?
10 till 12. Yep.
Beautiful. I'm just writing that down.
And
Well,
like I said, I'll send you that email again after this because you have contacted us. Sorry to overtake. I'll pass back
No.
to
No,
SENsational.
it's really helpful, Lee. It's nothing like a bit of action, and you've got action as a result of your speaking today, Rachel. I hope that's helpful.
Yeah, very.
Good.
Thank you, Lee.
Thanks.
Thanks, Lee. Okay,
Welcome.
I'm just gonna move to. Is everybody okay to just kind of power on with this? We're 10 till 12 today, and we don't really have a kind of structure of having a break at all. I mean, do we want to have a break and come back? I don't know. What are people's thoughts on this? Specifically, Nicola. What do you think, Nicola?
If everyone's happy to power on, then obviously if people need to have a comfort break, please do go ahead.
Yeah.
We'll just remain here. It's not a problem.
Okay, well, I'll carry on with the questions. So there's a question from our Facebook group. So my son is on the NHS waiting list for assessment ADHD, ASD, etc. I've done parent referral for EHCP as school were delaying doing it. He had an ASD school observation recently, and local authority have recently informed me they are agreeing to assess. But I wondered, do I need to refer him myself to CAMHS, or will local authority or school get in contact with you for this? So it's the last part. I'm not too sure where there's an obligation for CAMHS to be involved there. Anybody else made more sense of that than me?
So when I saw the message, I was thinking about the best way to respond, because if so our CAMHS services are for people with a mental health problem, so anxiety, low mood, depression, as well as ASD or NDD, for example. But the way that I read the message, and happy to be corrected if I've got it wrong, is that it seemed to me that the person that wrote it maybe was waiting for a diagnosis. And in that case, I think it's our colleagues in the NHS again, but community pediatrics that would do that. So I can't speak with utter confidence, but I believe whoever wrote the message should be able to phone up and ask for that to happen or chase it. But equally, so should the school. Sorry,
go on, Al.
So for us in CAMHS, then it would be, depending on the age of the person, it's a little bit easier to do a self-referral if the young person is over the age of 14, but schools or the local authority should be able to refer to us without issues, and any parent should be able to phone and get some advice from our duty worker.
Okay, that's good. So in that person's kind of question, there seems to be sort of NDS involvement there, doesn't there? So
yeah, that's the way I interpreted it, but apologies if I got that wrong.
Yeah, okay. So I've got another question. This is Sarah's question, Sarah Osh. So her question really is around whether there are any plans for kind of intervention and treatment to be more diverse. She feels like the offer is kind of a one size fits all. I think was her term. Mostly constrained to kind of talking therapies, CBT, short-term solution-focused therapies, and in her experience, what her young person has responded to is kind of, maybe something more along the lines of kind of art therapy or play therapy or kind of animal therapy. Is there any kind of talk about making the offer more diverse?
Yeah, so some of our teams are resourced in slightly different ways, but in Central, so at Mary Chapman House, we have 2 play therapists and an art therapist that would all feel comfortable supporting anybody. in West Norfolk, there's only one play therapist, and in East Norfolk, there is one play therapist, but she's also one of the managers, so her clinical time is quite reduced. But they've got a vacancy, so we're out to advert at the moment for a creative therapist, and we'd be quite open to the idea of that person having an art or a play qualification. None of the teams, I used to work in London, and in London we had a music therapist and a drama therapist, but none of our teams here in Norfolk have those things. But if people with those qualifications were interested in applying for jobs, we'd be really open to it. So there's I think that's a long-winded way, apologies, of saying that we do have some creative resource, and we're happy to use that.
Well, that's really helpful to to hear that you understand that the offer needs to be a bit more diverse, and also understand that actually the responsiveness of service users, of young people in need, would probably be much more engaged by having a diverse offer.
Yeah.
Sarah, does that answer your question? Do you want to come back on that?
Yeah, pretty much answers the question for me. It's just that, yeah, we are waiting, because we're in West Norfolk Thurlow House, we are waiting for the one female therapist, because it has to be a female therapist. That there is only the one female therapist. I suppose that's why we're waiting so long for our therapy.
And is that a creative therapist? Will that be the play
No, well,
therapist?
this was my problem. This is for exposure therapy, which I don't believe is the right form of therapy for trauma-based problems. Yet to have the issue out with Thurlow House themselves, that but you can't. I could get to speak to a duty worker, but I can't get to speak to anybody else. They say they're going to reassess her, but I only found that out by speaking to the duty worker. Not 100% sure where else to go or what to do. You just keep speaking to the duty worker, tell her things get worse. They just keep saying, okay, we hear you, and that's it. So yeah, I don't really know where else to go or what else to do.
Sarah, can I have a go at explaining a little bit more for Al about your kind of situation, the situation around suggested therapy, and you feeling and now having advice that the suggested therapy isn't the right one? Can I share a bit more about that?
Yes, please. Yes, because obviously I got the second opinion that it's not the correct therapy. Yes, please do.
So Al, the situation is that Sarah has a young person who has experienced some trauma in her life in early years, and also recently in terms of her school experience. And there was an assessment which suggested that actually, if she was going to receive mental health support, it would be exposure therapy.
Right.
And kind of that felt to Sarah and to her young person that it wasn't something that she would engage in, and didn't feel entirely sure that it would be effective, and actually wanted much more of a kind of child-led approach, a bit more like play therapy or equine therapy, or something a bit more creative. So she sought a second opinion, and the second opinion was private, and also agreed that exposure therapy would not be an appropriate, I suppose appropriate, it has connotations, but it would not be an appropriate approach. So I suppose the question really is might it be the case that a child is offered what is available rather than what is most appropriate?
Unfortunately, yeah, sometimes we can only deliver what we've got, so to speak, even if we recognise that there's a skill that perhaps we're lacking that would be more appropriate in that situation. However, Sarah, if it's okay to ask, how old is the young person that we're talking about?
She's 14.
She's 14. Okay, so she'd probably be open to the youth service.
Yes, yeah.
Okay, and are the youth service aware of the second opinion?
No, I only got that last week, so I've got to raise that with them. Yes.
So as a therapist myself, but I'm trained in ways to work with people around trauma, and there are alternatives to exposure therapy. So I wouldn't want, I don't know all of the details, and I don't want to presume to be an expert, but there should be other ways of doing this. So if I think I've been messaging you directly, haven't I? I've given you my email.
Yes.
If it's helpful, I can speak to my colleagues in the youth team and facilitate something between you and them so that they're aware of the second opinion and they can look at this in a different way.
Oh, that would be very helpful. Thank you. Yes, I'll email you the details. That'd be brilliant.
Great, no problem at all.
Thank you.
Thanks, Charles, and thanks for contributing, Sarah.
Thank you.
So just looking at the chat, I can't see any more questions in the chat. Shout if I've missed anything. And also, yeah, it's open to anybody if we wanted to. If anybody wants to, oh, Zoe, you've got your hand up.
Hi, thank you. Yes, I just quickly popped it up. I've got a question around accessing the services. Obviously, there's been a lot of talk about where sometimes it's the case that a diagnosis is needed. Obviously, there's two kind of elements. Some children require CAMHS because there's been a specific catalyst, or there is a long-term underlying mental health issue. Some children, it's a slow progression to needing mental health support because they're still waiting diagnosis. So it means they aren't getting the appropriate supports from other services. What are the plans, if any, to address this issue? So there's a huge lack of communication we've experienced between services. So when you reach CAMHS, sometimes they say to parents, oh, well, actually, you probably need to go down the diagnosis route, or you're on the wait list for a diagnosis, and we think that's the issue. However, during that time period and that wait, a lot of children then develop anxieties and mental health issues alongside their need for diagnosis because they're not getting the right support. So they're not getting an ASD specific support in school. They're not having a specific learning difficulty need met or social communication difficulties met. And that's led to mental health crisis points. What are the services going to do to communicate with each other to ensure that, because obviously there's huge wait lists with NDS as well. So you just get buffered from one service to another, being told you need a diagnosis, you need mental health support. The parents know that they need both of those things, but they're not working in line with one another. Does that have I made sense?
Yeah, perfect sense, Zoe.
Yeah.
So the honest answer is, and it's embarrassing to say, but it's a little bit better in certain areas than others. So what I mean by that is in central Norfolk, I think that the team here have a better working relationship with, say, our paediatricians than in other areas. And the way that I see that personally for the under 14 teams is that our specialist, our advanced nurse practitioner who I talked about before, meets weekly with them, and they have a kind of joint triage. So they talk about young people that have been referred in, and together they think what's the best support we can give them. Does it come from us in paediatrics, or does it come from us in CAMHS? And together they work out how to do that, and in the right occasions, if it's needed, they'll joint work as well. So that I think is encouraging. It needs to be built upon and made even better and grow. In the east of the county, so in the Yarmouth-Waveney area, they're trying to replicate that. So they're working with the, I think it's the Newbury Clinic there, and they're actually trying to employ practitioners that work across both teams so that it brings them together. There's a shared culture, shared learning, shared experience. And they're running that as something called a QI, or a quality improvement initiative, which we're trying to replicate in all manner, or different teams within the NHS, not just mental health, but essentially it's a toolkit to make services better. So they're doing it through that framework. And in King's Lynn, there is some good relationships, but probably, in my opinion only, not as good as it is in Central and not as good as it wants to be in Yarmouth. But we recognise this, and the week before last I was in a meeting with representatives from all over the county, from all the different services and commissioners, and the specific topic was, how do we make this better? How do we work more effectively to close the gap, to make sure young people and their families don't fall through the gaps, that they don't bounce backwards and forwards, that we do all that we can. And the commissioners are particularly interested in this at the moment. So there's going to be, I'm waiting to be invited to it, but there's going to be more work going forward on this.
So will parents be asked to put forward views for that, and what would help in the sense of services working together, or how would, as parents, we expect that to look? So for example, you've got a child who's on the NDS waitlist. You've been buffered from pillar to post, from community paediatricians to NDS, back and forth for years, and you've now got a preteen, and you're on waitlists with both, and now it's a point that both are needed, but you're on a 2-year waitlist with both. How do we expect that to look, and those teams to communicate? So I'm talking more extreme, where there is crisis for mental health at that stage, but there's also no support from the local authority education wise. So are they going to be included? So even when there's an EHCP, parents are funding absolutely everything because there's no school to meet needs. And also on the back of that, services like short breaks, where a child has been awarded short breaks, but it doesn't take into consideration mental health. So you're quite restricted on what you can use the short breaks for when you've got a child who has developed chronic anxiety. Like other people have said, you know, they struggle to get their children out of the house. And the short breaks provision is very specific, that children should be straight out in the community, that budgets that is there to specifically meet their needs doesn't work in line with mental health as well as their neurodevelopment needs, because you can't use it for transitional steps. You're not allowed to use that budget to, say, fund things for an allotment. So you're getting your child out of the house for a period of time before you then move them on to trying to go to a local play centre. Within teams starting to work together, are things, is it going to be like a whole approach or just specific services working together? Because there's a real lack of issue around short breaks, EHCP coordinators, as well as CAMHS and NDS.
Yeah, so let me try my hardest to answer, and if I'm not making sense, you stop me, Zoe. But to answer the first bit, yes, families need to be involved in whatever work is going to go forward. And I was actually going to ask you as a group today, would it be okay to advocate for you guys, and as I go to these meetings say, look, you know, I've met with this group of people and they would really like to have a voice in this? Because I don't think we should be making any improvements or changing anything without talking to the people that access the services and listening to their experiences and hearing their feedback. In fact, in quality improvement, that's one of the first rules, that you don't make changes without involving service users, the people that are going to use the service. So if you're okay with it, or if certain people are, please let me know, and I'd really like to advocate for you guys being involved. The second thing is, we're really lucky in Norfolk in that we've got something that's a little bit different, in that our Director of Commissioning sits not only over the NHS, but also sits over the local authority, so in children's services. So she has a foot in both camps. And one of her jobs, and I see her do this all the time, is to try to bridge the gap between community paediatrics, children's mental health, education, and the local authority, to bring people together. And only last week, a group of people facilitated a listening event where we had frontline clinicians, senior managers, and senior clinicians come together from all of those different services to think about how they can work together and improve. So I don't want to over-egg it or make it sound more impressive than it is. I think the focus for us at the moment is making sure that we try to close the gap between us and NDS or community paediatricians, but the plan is for all of those services. We need to take a holistic approach. We need to involve everybody that has contact with a young person for the young person to thrive, essentially. So yes, the intention is to involve the local authority, education, I'm not sure that this will make sense, but what I call the physical arm of the NHS, as well as us in the mental health services.
Thank you.
Thanks.
That's really helpful to hear, Al, because I think that is at the root of a lot of experiences, is that there is such a distance between the NDS and the mental health services and schooling. So bringing it together. I mean, we have an education, health and care plan, so essentially the hope was that those services would come together and talk to one another and use kind of a common language. And perhaps that hasn't, perhaps we're going to take a step further on with that, which would be great. Rachel, you've got your hand up.
Yeah, I'm hoping it's relevant, but basically I personally am really lucky in that I have lots and lots of experience working with disabled people through my jobs, college, relatives with disabilities. But one of the main things I noticed from all services that I've ever contacted, or at least 99% of them, is that there seems to be a lack of awareness of each other. And for example, when my son got his diagnosis, I think we got offered a little talk, but we were never given any information about where we could go for help and support. Obviously nothing's tailored. And I know quite a few people who are in the process of getting their children diagnosis or assistance or hooking up with services and things. And you as a parent have a lot of research to do because you're never told at any point what services are out there. And it's like, so is it when she said about waiting for that diagnosis before the school will do anything? Schools legally have to provide SEN support regardless of diagnosis status, but parents aren't told this. Parents have to research everything, go out of their way to educate themselves, because nobody offers information. It's almost certain services that I've been in contact with, it's almost like they want to contain it, like where you get stores that rival prices. It's like, oh no, we deal with this, we don't want you to go to them. And perhaps it would be something to think about, where as people approach CAMHS and they are facing these waiting lists, even something as simple as a blanket email with contacts, charities, websites, links to parent information, like the Send Local Offer or Family Voice or different websites, just information. Because I think a lot of people, I'm really lucky that I'm not one of those people, but I know a lot of people that have just been thrown into the wide world and they're expected to know everything. So even something as simple as an email, thanks for their services whilst you're waiting, here's a load of websites that might be helpful, I think can reduce anxiety for parents as well as young people, because there is a severe lack of information given about the wider world. Every service will talk about their own service, but doesn't necessarily give you direction on where else you could go, if that makes sense.
Rachel, it makes perfect sense. And as for your kind of questioning whether it was relevant, I mean, can we have a show of thumbs up for actually, it is really relevant. I think there is, it's quite, in my experience working with families and with young people, you can be struggling for a long time, and then somebody will kind of flippantly say, well, haven't you tried this, or haven't you tried that? And it's a service that has been out there for the whole time. Like, Open Arms Support, for example, they came on and they gave a talk, and they talked about how they have a kind of diagnostic pathway, an assessment and diagnostic pathway that, you know, nobody, that wasn't widely known. And it's things like that actually you need it. There should be an obligation for whatever service has told you you're going to have to wait, for them to say, but these are all the other things that you could try, and they may move faster than us. They may suit your individual needs better than us. And, you know, these are the things that you can have a look at. I mean, Teresa came on earlier on and said, you know, I'm quite an active, effortful parent. I think, you know, that is relevant for lots of parents who are worried about their young person. They're willing to do and try anything. I mean, you know, most of our parents, like Sarah has said, you know, have dipped into their own pocket to make things happen, to try and get change for their young person. So yeah, I completely agree. An understanding of what is out there, a comprehensive understanding of what is out there would be really helpful. So very relevant, Rachel, thank you. What have we got in the chat here? So one thing I just wanted to say, Al and Lucy, is that it dawned on me the other day, and I was in a meeting with Alex Church, who has just come in to children, young people's mental health, to look at the single point of entry for mental health, and he's looking at that. And also Simon Paler, who was in charge of is in charge of change for mental health services. And in talking to them, it kind of dawned on me that actually a lot of the time you've got a parent or a carer of a young person who has concerns about their young person, and they're not getting any support. So they make a referral. There's an assessment of this young person that says, you're right to be concerned. There are things which you know, could escalate and require intervention, but we can't do anything about it at the moment. And I'm worried that what that does is it confirms that their young person does have needs over and above. And you're confirming that to somebody who is not confident that they have what it takes to meet those needs for that young person. And so you're kind of leaving this situation where you're saying you really do need a lot of support for this young person, and then there is no support, and it sort of feels a little bit like maybe that's not the best input to have in that kind of relationship. Maybe a better input is to say, you know, clearly there are things which are leading to a lot of need for a different way of supporting in your family. Maybe, you know, the activities that you would normally engage in, maybe you need to rethink what is manageable for your young person. That may be school attendance, that may be socializing. You know, that kind of input may actually build the confidence in the parent carer that they do have what it takes to meet their young person's needs, even though those needs are escalating beyond what they have been in the past. Do you see what I mean there, Al?
Yeah.
And I wonder whether that is a change which could happen. So rather than confirming that a young person has escalated needs and then being left on a waiting list, like Zoe has said, for up to 5 years, I know it's an exception, but I mean, over months and months, maybe we need to say, actually have a more containing input?
Yeah, I know that Alex and Simon are both thinking really carefully about a front door service and looking all over the country to think about what's been helpful. And I think that they would like, and stop me if they kind of spoke to you about this already, but they want to make sure that it isn't just a door to a house that people come into, that it's something that can be accessed at any point of the journey for support and advice that's very much live in the moment. So, okay, you might be on a wait list for this particular intervention or support, but you can go back to the advice service for some kind of in the moment help. Yeah, and I would really value that as well. So you might be waiting for a very specialist thing, but there are these other ways of support and advice that you could benefit from in the moment.
Yeah. Because I mean, I don't have a young person that is using any services, but I would imagine from speaking to parents who do, that actually more input from mental health services to increase the confidence in the parent carer that they do actually have what it takes to support their young person would be helpful. I don't know. I mean, there's a few nods, but I mean, has anybody got any thoughts on that? Lenora, Rachel, Sarah, Louisa, any thoughts on that? Like,
so can I just jump in?
Yeah.
I actually was told about a book which is called Never Let Go by Suzanne I can't think of her surname now, Alderton or out something, which basically it goes against the grain. I mean, when we first started having problems, we were stressing about getting her out to school, getting her this, that, the other, shouting. There's so much shouting going on and screaming back, and it just basically gives you a different way of helping your child along this journey. And it's a journey that you sit there, you support them. You know, if she can't go in some days now, she's not going in. And, you know, I know I'm not helping her in the long run. Well, I am helping her in the long run, but obviously I've gone along with that book now, and it's absolutely brilliant. It just shows you a different way of, you know, basically parenting mental health. And it's given me more confidence with my daughter, just to, you know, kind of like open up to her, discuss things better with her. She's now, you know, coming up to 14, and she understands a lot more. So when she opens up now, whereas she never used to open up, and it's the way you speak to your child, you speak to them, not at them, kind of thing. You know, it's completely changed us, you know, going forward. But yeah, I don't know. It's yeah. I mean, I've gone along the line of books, really, because obviously she hasn't been out the house a lot, and it, you know, it ties you down. So I'm literally looking at books a lot. So,
which has made a big difference, hasn't it?
Yeah, for us it has, yeah.
And so, I mean, if there was some way of, when you first picked up that phone to mental health services, for those to have been the ones who signposted you at the earliest possible time to a book like that could help relationships, could help with connection, could help with understand.
I mean, to be honest,
could make a difference.
We are, you know, early days, we were literally on the verge of kind of like, well, splitting up, myself and my husband. It doesn't just affect that one person, it affects everybody, doesn't it? And it's just our way of dealing with it, you know. Everyone's sharing this book, and it's, you know, yeah.
But your way of dealing with it is probably relevant to lots and lots of cases of mental health in families.
Yeah. You know, we're clinging onto our house with our fingernails and things, but you know, we've had to spend out an awful lot. Obviously, you know, it's hard, you know, money wise and things. So just for DLA forms and things like that, we were told she'd be entitled to DLA. We've been turned down twice. So literally everything is coming out of our pockets, but we didn't know where to go because we've never had to go to Citizens Advice, we've never had to go to Job Centre Plus, and it's just, we knew nothing about what we could be entitled to, what we can't be entitled to, and it's just having those kind of like bookmarks all along the way, that would have been a massive help to us in the beginning. But yeah, signposting would be great, would have been great.
Yeah. Thanks for coming in on that, Lenora. Lucy, I can see you've got your hand up.
Hello, sorry, hang on. I'm just making a little note of that, that's okay. Just out of curiosity, so something that I'm really advocating for at the moment is peer support workers, and I'm happy to explain what a peer support worker does if anyone would like me to. It's a long process and there's no guarantee that we will get peer support workers, but it's something that I'm really fighting for. And the way that I envision that is having peer support workers that will work with our young people, but I also want parent carer peer support workers. But I've never worked in that, so my background is peer support, which is why I'm fighting for it, because I think peer support workers are great. They have their own lived experience and they kind of talk to you about things in a different way and can kind of support you through navigating through all these challenges that are kind of being brought up. If we were to have peer support workers representing and supporting parent carers, does anyone have any idea of how that would look, what would be useful, how that could be used? I guess I kind of envision that it would be somebody who's been through this and is, or maybe going through this, but can provide that guidance and support, and to say like, this is what it would like for me and this is how we got through it. Is that kind of how people would see that? I'm kind of open to any ideas about that, really.
Yeah, great. Rachel, you've got your hand.
Yeah, no, I can imagine peer support work as being amazing. Just having somebody semi-official, a lot of people don't want to go too close to home because then there's like this fear of judgment. You go to a friend, and especially when your children are involved, raising children is a competitive sport to some, so you definitely want something impartial and official, but having somebody that could be at the end of the phone, almost like a drug sponsor when you're having a rough time, just having somebody there that can talk you down in the moment, somebody that has information, shared experiences, somebody that knows the services that can go, now your best bet is this service, but while you're waiting for that service, contact this service, or expect this, or I've had a bad experience with the school, what do I do? And for somebody to go, well, actually you've got to tell the school this, and this is the best person to go to for advice on this. Just somebody that knows something, somebody that's lived through it before, and somebody that's available. Because parenting is really lonely and incredibly stressful when you're watching your child not thrive. But I've got to go on a school run, so I'm going to leave it at that. I've got to go get my kids.
So thank you so much.
Thanks very much for joining us, Rachel.
Thank you.
Thank you. Bye, guys. Bye.
Sorry, did I talk over someone else then?
No, that was me saying thank you.
Oh, that was you saying thank you. Yeah, so Lucy, it sounds like Rachel had in mind a kind of an allocated person that could support. I wonder whether you were thinking a bit more, or another option could be kind of groups that people would come along to, like a kind of coffee morning, an easy kind of chat. Something like this, if it was, if it was scheduled at the right time, or if you had a sort of drop in that people could book into or something like that.
Yeah, that's kind of exactly what I was hoping with the role. I mean, like I said, it's still something that I'm still fighting for, but when I was a peer support worker, I would hold groups, I would run webinars when we went into lockdown, I would work one-to-one with people. And that it not only has like a benefit for them, but it also benefits you as well, because you learn so much about all sorts of different things, but because you have to manage your own mental health as well, you kind of learn strategies from people. And I think that relationship is incredible. And I love peer support, and like Al will know, I go on about peer support workers all the time. So yeah.
No, I'm
really fighting for.
Yeah, that's really good. It's good to hear that, and I'm in complete agreement. I think you know, if we can spread the kind of helping ethos and all of the really healthy neurochemicals that get released when you make a positive connection with somebody, you know, there are so many opportunities to benefit from that we're missing all the time. You know, this talk today has been fantastic for connecting and feeling less alone in your situation, and getting strategies that will help, and actually giving people an opportunity to show empathy and compassion, and us having more empathy and compassion for Al and for Lucy as well, because, you know, you're working really hard to make a difference for a tidal wave of difficulties, and you're still at it. And, you know, we have a lot of respect for your determination and your determination to change things and give us a different experience. And the only way we can do that most effectively is if you hear from everybody about how you've been experienced and the services have been experienced, and then you're able to kind of talk about how with those experiences you can keep improving and keep changing things. So and Lucy, I think it's, you know, what we have to remember is that, you know, for everybody that has a need, that is somebody who has an experience that can then support. So, you know, if we have lots of people with growing need, we have lots of people who have natural compassion and empathy to stop people from feeling such need. So it's when you take the peer support approach, you're building helpful experiences all the time, aren't you? So that's fantastic. I'm going to bring in Lee. Lee, thanks very much.
No, it's lovely, thank you. Just more of an operational thing, really, just for Lucy. We're working quite closely with the library service at the moment, training up autism champions so that they can then run peer groups themselves. So what's good with the library service, obviously they're quite local. They can cater to the demographic of the area. So that might be something you want to explore.
Yeah, definitely.
You can set up a lot of groups very, very quickly doing that. So that might be something you want to have a look at. Some mental health champions, because I know there is mental health champion training, isn't there, already in place? Is that through you guys, or is that through NCHC? I can't remember. But yeah, that might be something you just want to look at. It's just an idea I thought I'd pass on.
Yeah, that'd be really good. And we are setting up like a participation champion role, so that we'll have dedicated members within each team across all the care groups and all the teams within NSFT, who will be trained to talk to people like this and have that feedback and run groups. So that's something we're developing as part of our participation team rather than within the children's care group. So yeah,
I've got a friend over in Staffordshire, so this is probably going completely off topic, but she runs the youth engagement participation over there, and I know she's made some very big strides in mental health and getting things like that. So if you want, I can always put you in contact with her to see how she's done it over there, and just
that'd be brilliant. Yeah, thank you.
Yeah, love it. I'll send you an email after this then, Lucy.
Thank you.
No worries.
Yeah, Lucy, there's also a really great group in Yorkshire called Chili Pep. So check out them. They're fantastic too. I'm just going to read through the chat. Okay, so Nicola's put in the chat the book Never Let Go: How to Parent Your Child Through Mental Illness, book by Suzanne Alderson. So that's the name, Alderson. And Sarah, you've put, it'd just be nice to know if we as parents are doing the right thing, as we're not mental health specialists. So again, Lucy, that's peer support, just to kind of reassure and have confidence. Zoe's put, totally agree with the letting go. The battle for many in schools and attendance, fine, threats, and having been through court ourselves for this is a huge issue many face because schools aren't understanding or on board for these needs. So, you know, it's all very well having a parent and a carer who is attuned to needing to lower the expectations for their child, but the systems around, they need to be more understanding as well. And, you know, it's not helpful for a parent to show the right care to their child if they're being forced to make a decision to also avoid fines and legal threats and things like that. So yeah, that's a good point, Zoe. Yeah, Sarah saying it'd be good to share experiences. Jenny, who's one of our family support advisors, she's put young minds offer parent line 2, more online parenting courses to support parents living with mental health would be helpful. Is that something that you would be looking to do more, Al?
Yeah, hopefully. We've got so many ideas, if I'm honest, that it's hard sometimes to pick the one thing and really run with it. But definitely we've run online support groups for parents of young people who are anxious, and we just want to build upon that and keep developing. So that is a great idea.
Yeah. How about this? SENsational Families do a host where you and Lucy come on and do this every single week, and we just get more and more and more parents and carers who can talk and build that peer support. How's about that? That is a marriage made in heaven. Okay.
You chair, yeah.
Yeah, sorted. And then Jenny says, or groups for parents to support each other. Yeah, so supporting their child or young person with mental health, like SENsational Families Facebook group. Good. And Nicola's put, if people would like to feedback more to Lucy and Al, we're happy to pass these on. And there's our email address if you'd like to. Zoe, you've popped a question around wait lists a bit further up in the chat. Okay. So, okay. So whilst aware the system of who gets support first has to be quite a brutal one due to lack of availability of services, one of the things we experienced and are experiencing now with no further calls of support on waitlist was a comment of, you're very competent, so we have to prioritize other families. However, this missed the point that many of us are caring for 3 people full time on 3 hours sleep. And without this support, we reach burnout. Why are families made to wait if the parent is deemed competent when that does not mitigate the support their child needs, but urgent support, or for parents to receive that ongoing support? So it's a really, really relevant point for our cohort is, you know, the burnout. What's your response to that, Al? You're on.
People should access support. Young people should access support based on need, not the quality of their parents. Does that make sense? So I don't know. That doesn't feel right that was said. It's a strength to a young person that you will care and support them in the way that you do, and a credit to you and them. But really, we should be allocating based on need, not on how good you are at helping them. So that, I think that's my funny way of saying that shouldn't have been said.
And I completely agree. What could have been said is that that actually, you know, if mental health professionals want a parent to know that they are competent, then perhaps, as Lucy suggested, you know, they could be a good candidate to come together with other parents and feel supported by other parents, but also be able to support other parents. Yeah, it may be an empowering thing, mightn't it?
Yeah.
Because it feels like that person was wanting to empower that parent, but actually that parent really wanted somebody to step in and take some of the load. What do we do to address this issue so they aren't waiting longer? So that's an add-on to Zoe's question about, you know, if they're saying that the skills of a parent mitigate the needs of the child and that results in them having to wait longer, we're saying that that is wrong. What are we doing to address that?
Well, in order to challenge it, I should be talking to my colleagues in the under 14 teams and saying that we have to make sure we don't make these mistakes again. But in individual cases, I would encourage you guys to speak to the duty worker or the team manager and say, actually, don't put me further down the list, or don't pretend that I don't need something just because of the good job that I'm doing. You know, if anything, because of these needs, I should be expedited.
Yeah, absolutely. Okay, has everybody who wanted to speak, have they spoken and said what they wanted to say? Because we've just got 5 more minutes left. Silence is speaking volumes, I think. Okay, well, I think we should wrap up. Thank you so much to everybody for your time today. Thank you to Lucy and thank you to Al for your patience and for your determination.